Good morning and welcome to Plainfield Public Library's presentation of Coverage to Care, Making the Most of Your Health Insurance Policy. My guest today is Greta Latby from the Family Resource Network. This program is sponsored by Plainfield Library, courtesy of the Healthy Plainfield Initiative and the Family Resource Network. We have recorded other health insurance assistance that from the Family Resource Network that is available on the library's YouTube page, and you are welcome to view that as well. I'm Jennifer Heiss. I'm one of the reference librarians here. If you have any questions about the library's services, you can reach us by going to our webpage, www.plainfieldlibrary.info, or calling us at 908-757-1111, extension 112. So now I will hand it over to Greta, who will give us the presentation on Coverage to Care, Making the Most of Your Health Insurance Policy.
Hello, everyone, and thank you, Jennifer, for the introduction. My name is Greta, and I'm with the Family Resource Network, which is an umbrella organization consisting of 3 affiliates: Autism Family Services of New Jersey, Caregivers of New Jersey, and Epilepsy Services of New Jersey, and also the home of our Health Insurance Navigator program. Today, I'm going to be talking to you about coverage to care and how to make the most of your health insurance policy. But before we jump in, I wanted to mention that open enrollment has been extended until the end of the year. With the American Rescue Plan Act of 2021 being passed on March 11th, there will also be an increase in federal financial assistance when signing up for health insurance through the marketplace. So without further ado, let's get started. All right, so what is coverage to care? Coverage to care aims to help you understand your health coverage and connect to primary care and the preventative services that are right for you. So it's important to have health insurance, but also just as important to know how to utilize it to your needs. Next, we'll be going into the 5 ways to make the most of your health coverage. So we'll be diving deeper into these 5 categories, but we'll talk about confirming your coverage, knowing where to get help, locating your providers, scheduling appointments, and following your plan of care. Confirming your coverage. So after you've selected your health plan on the marketplace, make sure you pay your first monthly premium to activate your policy. So say you fill out your application today, March 30th, your plan will go into effect on April 1st. Or say you fill it out April 15th, your plan will go into effect May 1st. So it's really important to pay your first monthly premium, and you can do so online, or you can also call the insurance company. And then also submitting any supporting documents that the application may request. Knowing where to get help. So you have 2 options. You can contact your health plan to find out costs and coverage information. And then you can also contact our certified health insurance navigators for assistance with contacting your plan and understanding your benefits. We're here to help with any request, any question, depending on what your needs are. That's how we respond to the situation. So no question is small, and just feel free to reach out to us. Locating providers. So you can locate your provider by contacting your health plan via phone or online. Typically, they do have provider directories online, but you can also give them a call. Health insurance navigators can share the provider phone number with you, or we can call together and help find the providers in your area and in your network. Scheduling appointments. So when making an initial appointment, confirm your provider accepts your health insurance plan, and you can ask the receptionist or the medical assistant that you're making the appointment with, and they will be able to answer right there and then. Discuss preventative services with your new provider and any concerns that you have, and schedule any screening tests like blood work, radiology, and mammograms. And following your plan of care. Based on your visits and test results, your doctor will write up a plan of care, and it's really important to follow that plan and fill any prescriptions that you may need. Next, we're going to talk about roadmap to health, and the 8 steps to a better you. So this is the roadmap, and I'll go into more detail in the next few slides, but um, step 1 is putting your health first. Step 2 is understand your insurance plan. 3 is find a provider. 4, make an appointment. 5, be prepared for the first visit. 6, decide if you like the provider. And this step is really, really important. If you don't feel comfortable with your provider, it is okay to go back to step 3 and look for someone else. It's really key in taking control of your own health, feeling comfortable with the care that you're receiving. And then once you do find a provider that you feel comfortable with, step 7 is next steps after your appointment. Putting your health first, getting regular checkups and following a healthy lifestyle. And of course, it's very normal to sometimes get off track, but it's really important to get those regular checkups and just be in the know about your health. And many screenings come at no cost. A lot of preventative care is free. And then keeping copies of your medical records is also really important. Say you decide to switch providers, and of course, you can always contact your previous provider to send over your medical records, but having them on hand and in your possession makes it a little bit of an easier transition into a new provider. Understanding your insurance plan. So we're going to discuss a lot of terminology like co-payments, deductibles, co-insurance, max out of pocket, and that'll be discussed in a few slides a little bit later in the presentation. And we'll also talk about in-network, out-of-network, tier 1 and tier 2 providers, and then also looking into your plan to familiarize yourself on what is covered by your health insurance plan. And navigators can help you do this portion as well. Know where to go for help. So for all regular and sick visits, call your primary care provider. But in case you're feeling sick and it's outside of regular business hours for your primary care provider, you should visit a walk-in clinic. And then in case of a life-threatening emergency, call 911 or go to your nearest hospital. Finding a provider. All health insurance plans provide a list of providers on their website. And you also may be assigned to a provider automatically when registering for health insurance. And if you wish to change your provider, you can contact your insurance company. And I also want to mention, it could be, health insurance navigators can email you the provider list. We can look at it together via Zoom. It really depends what you are looking for. And we're very flexible with hours as well. We have evening hours and weekend hours. Making an appointment. If you're a new patient, you'll be asked to provide your personal and your health insurance information. And then verify that the provider accepts your insurance and that they are in-network provider. And again, this can be done by just asking on the phone when you're making your appointment, and also checking online, which we can do together with you and your health insurance navigator to make sure that there are no surprise bills. And then requesting a day and time that works best for you. being prepared for your visit. So having your insurance card and your ID card with you, knowing your family's medical history and making a list of medications you take, bringing a list of questions you'd like to ask your provider, and also take notes. So I think this is probably one of the most important keys to highlight, because I know personally, once I get into the office, I tend to forget questions that I've thought about days before the appointment. So I like to make some notes either on my phone or on a piece of paper, just so I can have everything there in front of me and I'm not going to miss anything that's of importance to me. And then yes. Oh, I'm sorry, I can't hear you. I think you're muted.
I had a question that actually came up with somebody today. What kind of ID do you need to provide other than your insurance card?
You could bring your driver's license, your a job ID.
Thank you.
No problem. All right. And then taking notes. So this is going to be really important on your first few visits when you're deciding if you have a connection with your doctor and someone that you feel good with. Take some notes during the meeting, and then when you come home, in retrospect, you'll be able to kind of see if this is the right fit for you. If you need assistance during your visit, you may also bring a chaperone or request one. Deciding if the provider is right for you. So, some questions to ask yourself when you come back from one of your first visits is, do you feel comfortable with your provider? Does he or she address your questions and meet your needs? And again, it is perfectly fine to change your provider at any time. If you want to change your provider, just return to step 4 of the roadmap to better health.
Greta, we do have a person who just came into the session.
Welcome. Thank you for joining.
I just wanted to let you know. Do you want to tell them the good news that you told me when we first started?
Yeah, absolutely. So we were notified last night that open enrollment will continue throughout the end of the year. And there has also been an increase in federal financial assistance for people signing up through Get Covered NJ. So open enrollment is no longer ending May 15th. It will continue through the end of the year.
If you have any questions that you'd like me to ask Greta, you can type them in the chat box. We are going to be recording this session, so we don't want to record people's names or their voices if we don't have to. Okay, thank you.
Okay, thank you. All right, so next steps after your appointment, following your provider's plan of care, filling your prescription and taking them as directed, scheduling follow-up visits if applicable, and then you will also receive an explanation of benefits from your insurance company, which after this presentation, hopefully you'll know and understand more of the terminology. And then if you have any other questions, reaching out to your health insurance navigator is also an option. So now we're going to get into the terminology of understanding your health insurance plan. Deductible. So the deductible is the amount you pay for covered healthcare services before your insurance plan starts to pay. So there's typically a high deductible plan with low premiums, and premiums are what you pay monthly towards your insurance plan. And then there are low deductible plans with higher premiums. And pretty much it all depends on your needs and what you are looking for in your insurance plan. What is out-of-pocket maximum? So this is the maximum amount that you will spend out of pocket in a given calendar year. Copay, A copayment or copay is a fixed amount for a covered service paid by a patient to the provider of the service before receiving the service. And in most cases, copays do not count towards your deductible, but they do count towards your max out of pocket. Tier 1 versus Tier 2 providers. Tier 1 means that you will pay a lower copayment or coinsurance because the provider has a relationship with the insurance company and they're almost in network. So Tier 1 and Tier 2 and in network and out of network can sometimes be used interchangeably based on which insurance company you are working with. And then Tier 2 means higher co-payments and or coinsurance because they are out of network. And what is an in-network provider? So in-network refers to a healthcare provider that has a contract with your health insurance plan to provide healthcare services to its plan members at a pre-negotiated rate. Because of this relationship, you pay a lower cost sharing when you receive services from an in-network doctor. And this is why I mentioned in the beginning of the presentation that it's really important when you're making your appointment to ask the receptionist or the medical assistant if the doctor is in network with your plan. So there are no surprises in any bills. What is a drug formulary? So this formulary is a list of generic and brand name prescription drugs covered by your health plan, and it'll be in your explanation of benefits packet. This can also be accessed before you sign up for a plan. So when you are on, say, the marketplace, Get Covered NJ, there is a link to your explanation of benefits, and this medication formulary will be on there. And finding local help. So the Family Resource Network Navigators can help you understand your health insurance benefits. Our navigators are a team that speak English, Spanish, Russian, and Lithuanian, and our services come at no cost. A lot of people are surprised when we tell them, this service is free, and it really is free. There's no cost. And we do have weekend hours and evening hours, as we know people's schedules vary. So on the next slide is our contact information, our phone number, email address, and our website. So feel free to take a screenshot. And then the process is pretty easy. You would call the phone number and then you would be able to schedule an appointment for about, depending on what the question is, but typically it's about 30 minutes to an hour. And then if more time is needed, that is absolutely fine. And yeah. So next is questions. Trying to open the chat. Let's see. Right.
I'm not seeing any specific questions, but could you bring that roadmap back up again? I thought that was really useful.
Absolutely. And also, Jennifer, I can send you the link. So this is on the CMS website. So I can definitely send you the link to this.
So it's that put your health first, understand your insurance plan, find a provider, make an appointment, be prepared for the first visit. Step 6, decide if you like the provider, is really important. I know that sometimes we get the impression that we can't change our provider after we've signed up with one, but that's not true, right?
Absolutely. So they are there to help, and it's really empowering to put your health first, and it's a really important step in putting your health first. If you do not feel comfortable with a provider, that is okay. There's nothing wrong with that. That just means you need to look for someone else. And we are here to help through that step too. There's nothing wrong with it. It's okay. And it's actually more common than you think. And then just know that once you have the provider that you feel good with, that's when you really start, your health journey, because you mesh with that provider and you're comfortable with them. So you're going to be comfortable voicing any concerns that you may have.
I'm going to stop the recording for a minute in case anybody wants to ask a question out loud. I'm going to pause the recording.
Sure.
So Greta was telling us that if you have questions about Medicaid, it's through offices called what again?
So I think it was Medicare.
Yeah.
Yes. So Medicare is goes through the office of SHIP. So each county has a SHIP office, SHIP. And if you have any questions regarding Medicare, you would go through that office. Now for Medicaid, which is New Jersey Family Care, we also assist with applications for Medicaid. So the application would be pretty similar to the marketplace application, but the only major difference is that through Medicaid, your insurance kicks in pretty much almost right away. It doesn't wait until the beginning of the following month.
Thank you. And in case anybody hasn't seen the previous video, who's watching this one now, how do we get coverage here in New Jersey?
You would visit the Get Covered NJ website or through New Jersey Family Care. But the main way is through Get Covered NJ, and then may you qualify for New Jersey Family Care, aka Medicaid, then you would be referred to them.
Thank you.
It's our new platform. A lot of people are probably familiar with this platform as healthcare.gov. But this year, our state launched their own marketplace, and it's Get Covered NJ. Okay. Any other questions?
And again, don't hesitate to reach out to the Family Resource Network. Their services are free and they will meet with you online or on the phone, correct?
Yes. So I brought up our contact information again. So you can make an appointment in two ways. You can either call us or email us. Our services are free, like Jennifer mentioned, and we can chat on the phone or set up a Zoom room, whatever you are comfortable with. And no question is small. So if you have any questions at all, feel free to contact us, and yeah, we'll go from there.
And I was interested to notice that the Family Research Network, there are other insurance assistance programs out there, but the Family Resource Network is one of the ones that is not affiliated with any insurance company or any insurance broker. So they don't have any reason to favor any particular program for you.
Right. So we are not biased with regards to any insurance company. So our main priority is really having a conversation about your needs and what you're looking for. Not trying to sell any insurance plan, but really getting to the bottom of what are your health priorities.
Okay, well, if there are no other questions, I would again say that we have this video and the previous video on getting coverage available. Well, they'll be available on our YouTube site for Plainfield Public Library. And you're welcome to reach out to the Family Resource Network or to the library And we'll be happy to refer you to somebody who can help you. And thank you for watching this video, and thank you for attending.
Thank you.